Hello, my name is Marge Benham-Hutchins, and I'm from the University of Texas at Austin School of Nursing. My email is here if you would like to get in touch with me. My part of the presentation today is on meaningful educational use of the electronic health record. This is one of my favorite quotes. We have moved from patients experiencing individuals as caregivers to patients experiencing systems as caregivers. It's not just individual brilliance that matters anymore, it's a coordinated effort. And as you know, the healthcare environment is made up of multiple care settings, and patients have short encounters with multiple providers. Electronic health records were developed and implemented to support patient clinical information exchange across these multiple settings and to allow providers to build on the care of previous caregivers. This presentation will explore the longitudinal use of the electronic health record for nursing student clinical learning. In other words, how do we leverage the electronic health record for nursing education? Many nursing education programs focus on electronic health record training that emphasizes entering data into the electronic health record for pre-licensure nursing students. And it's not unusual for advanced practice nursing students to have a focus on order entry. Undergraduate students develop care plans based on information from electronic chart, such as the patient history, test results, and the current problem list. I am presenting that the electronic health record provides tools for nursing students to incorporate the data information, knowledge, and wisdom model into their learning activities. Most nursing informatics specialists are going to be familiar with the DIKW model, but nurse educators may not be familiar with this model. Many nurse informaticists will recognize the DIKW, Data Information Knowledge Wisdom Framework. This framework has been used by nurse informaticists for quite some time. So you'll recognize that the y-axis represents the increasing complexity of the various tasks, and the x-axis represents increasing interactions and interrelationships. You'll also note that there's a constant flux, that is a movement between these different levels for nurses as they provide care. So when we are focusing on data entry and reviewing the patient record, we are actually focusing on the two lower levels of this model: data, that is the naming, collecting, and organizing of patient data, and information, which is organizing and interpreting. This happens when they review the patient record, and the data happens when they enter patient data for documentation purposes. An important assumption is that to optimize learning, nursing students should have the ability to track a former patient in the electronic health record to learn about the results of their interventions and the patient's progression. This review of the record allows the student to move to the knowledge and wisdom levels of the DIKW framework. So here we see the Data Information Knowledge Wisdom Framework. And as we mentioned in the other slide, the x-axis represents increasing interactions and interrelationships. So by students reviewing the record of a previously cared for patient, they can combine their current level of knowledge and clinical experience and learn. They can interpret, integrate, and understand and build their knowledge. And the wisdom level of the DIKW is something that they can start to build on, and it's important for them to know the response of their previous nursing interventions. And this will then help them with the understanding, applying with compassion that is part of the wisdom level of this framework. So as we all are very familiar, there have been many federal initiatives that have resulted in rapid adoption of the electronic health record. The focus has been on a primary function, and that's to improve patient care. HIPAA guidelines and privacy guidelines do not directly address longitudinal access for education. Some people have interpreted student and provider access to the record of a previously cared for patient as being permissible as an improvement activity or healthcare operations activity. It's very important for us to clarify this in order to encourage hospitals to implement policies and procedures that will allow students to go back and view the record of a previously cared for patient. The data in the electronic health record presents us with many learning opportunities. Big data initiatives have included an emphasis on harnessing this data for research, clinical outcomes, and precision medicine. But the potential for enhancing healthcare provider education has not been addressed. There's little written about the use of the EHR for tracking of previously cared for patients by students. The current literature that I was able to find addressed medical student benefits, such as the ability to track outcomes, diagnostic error rates, and identify mistakes. And some discussed how they currently were accessing previously cared for patient records, but that the policies were very unclear and they were doing it anyhow. But what about nursing students? The clinical experiences of nursing students vary. I developed this model that I call the reflective clinical learning experience based on the idea that reflection on previous cared for patients will help students to provide better care to future patients. So the idea here is that the student would have the clinical experience, they would provide and document patient care, they'd be able to reflect on that experience, and then on their next clinical day, they would be able to review the electronic health record of the previous cared for patient. And then they could reflect on the results of the previous patient care, and then that would then help them provide better care in that particular clinical experience. For example, it would be important for them to know, was the patient transferred to a higher level of care? If it was during their shift, did they witness a code, a rapid response team? Was there a planned transfer? What happened to the patient when they left the unit? How did the nursing interventions of the student influence the patient and how the patient did? What happened after your shift? Did you prepare the patient for surgery, but they did not come back to your unit as perhaps it was planned? What happened? So building in the ability to reflect, what happened, what could I have done differently, is an opportunity to learn through experience that can be emphasized and enhanced through the ability to review the electronic health records of previously cared for patients. So let's quickly revisit the DIKW framework and look again at the different components of it. If you recall, the y-axis was the increasing complexity, and then the x-axis was increasing interactions and interrelationships. So as you move up the chain from the data, information, knowledge, wisdom, and then back again because of the constant flux, it's important that students move beyond just entering patient data and reviewing the patient record to combining their current level of knowledge and building on their clinical experience. That is integrating and understanding from what happened with their previously cared for patients. And this will help move them to a higher level for practice, where it's important to know the response to previous nursing interventions in order to understand, apply with compassion nursing interventions. So what needs to be done? There need to be changes to provider education that include clinical experiences that incorporate longitudinal patient care. We need to incorporate reflective clinical education that brings in the principles of the DIKW model. We need to develop policies and clear clinical procedures that support student access to information on patients they previously cared for. And it's important that if we're to do this, that we need to incorporate patient consent and confidentiality, patient preferences, perhaps through patient control over EHR access, when and by whom, who would actually be able to access, and can they give permission for a student to access their record after the time when they're cared for? Or is that necessary? Does this particular activity fall under HIPAA guidelines? And if it does, then it needs to be very explicit so that people can move forward with allowing and be comfortable with allowing students to access the records of previously cared for patients. What else can you think of that we need to do to move forward? So this presentation discussed how reflective practice can be integrated into the curriculum through use of an electronic health record. And it presented a summary of how the DIKW, the Data Information Knowledge Wisdom Model, can be incorporated into nursing student education. This access to the EHR of previously cared for patients also provides the opportunity for nursing students and practicing nurses to learn how the care they provided influence the patient's outcome. I'd like to just briefly present a few things to think about, such as what are the policies on student access to previously cared for patient EHR at your clinical sites? What concerns do you have about allowing nursing students to use the EHR to track previously cared for patients? Is it different if they're on the same unit, if they were transferred to another unit? What if they were discharged? Do you think that nursing students would benefit from reviewing the record of a previously cared for patient? What about patient privacy and confidentiality? What safeguards do we need if we're going to expand or clarify access to the EHR for learning purposes? And this not only applies to nursing students, but how about practicing nurses? What type of access do they have to the EHR to enhance their ability to learn from the care they have provided?